Altered Physiology, Mechanisms of Disease 2, our continuation of our lectures on alterations of the cardiovascular system with a focus on rhythm disorders and in particular atrial fibrillation. Here in episode 4, we will highlight the clinical presentation of AF as well as treatment options and management. On this first diagram, you can see the clinical presentation of atrial fibrillation and atrial fibrillation related outcomes. Notably, patients can be either asymptomatic or symptomatic. And so, in the case of individuals who are symptomatic, they may have a number of signs and symptoms that we've highlighted in our preceding lecture episodes, such as chest pain, as well as syncope, disordered sleep, dizziness, uh, other comorbid states such as heart failure. So there are a number of different reasons why individuals can be symptomatic. And once again, the symptoms may vary significantly between individuals as well. Now, if we look at the right-hand side of this particular diagram, what you can see here is that there are a number of different outcomes following an AF diagnosis. While individuals can live several years, if not decades, with atrial fibrillation, once again, individuals tend to be at an increased risk for death, stroke, left ventricular dysfunction, or heart failure, cognitive decline with the development of dementia, depression, impaired quality of life, and hospitalization. In this particular chart, you can also see the frequency or presence of these outcomes, which tend to be elevated in the context of atrial fibrillation. The mechanisms to explain these various outcomes have also been outlined here in this table. Now let's take a look at the treatment of atrial fibrillation, particularly in those individuals who are symptomatic. One of the first steps is really to attempt to control the heart rate, and this can be done through the use of beta blockers, which act on the beta adrenergic receptors to try to dampen or mute the high heart rate. You also have calcium channel blockers, which can also be used. In some cases, this pill in a pocket type approach, so taking this medication either on a regular basis or even as needed as symptoms present, can help to resolve symptoms. And so this may be all that is really required. However, if the symptoms do not resolve, then individuals may modify the medication, so in terms of dose or frequency. They may also consider rhythm control. And so there are a number of treatment options, once again, including medications, but also including ablations and cardioversions to try to restore the normal sinus rhythm. It is important to remember that the management of atrial fibrillation requires an integrated approach. An sample integrated approach is highlighted on the screen here and may include patient education and self-management to understand perhaps what may provoke atrial tachycardia in a patient. Healthcare professional education, lifestyle modification, and psychosocial management are also cornerstones. Individuals must also develop strategies to promote medication adherence and work with a multidisciplinary team over time to ensure that their AF is controlled. Now, specifically, I want to highlight the idea around AF management and risk factor modification as it may have an impact on outcomes. So, in the preceding lecture slides, we highlighted the idea that AF over time may lead to pathological remodeling of the heart, and it also may lead to stroke and even death. And so, if we can look at the contribution of various AF risk factors, then we may be able to improve outcomes. On this particular slide, what you can see here are some of the major factors which are considered risk factors that can be modified for improving outcomes. Improving blood pressure or hypertension, optimizing physical activity levels, diagnosing and managing sleep apnea, reducing or stopping alcohol intake, managing high lipid levels, stopping smoking, weight reduction, and glycemic control. These are all factors that can be considered in the management of AF. We'll explore risk factor modification in the next episode.